I'm Ava Pierce, a professor of emergency medicine at UT Southwestern Medical Center. The next topic in our Race and Racism module is recommendations for practice to address racism and move towards anti-racism. The authors have no conflicts of interest. Our objectives are to describe how reducing implicit bias can lead to the delivery of more equitable care at the bedside, describe how advocating for systemic anti-racism strategies that dismantle structural racism can lead to more diverse and knowledgeable providers and the delivery of more equitable care. Racism should be addressed at multiple levels, including the individual level, the system level, and the societal level. Engaging in open dialogues within emergency care institutions is indeed crucial for addressing implicit biases and the impact of structural racism in patient interactions. Steps that emergency care providers can take to recognize and address implicit biases include education and awareness, familiarizing yourself with research on implicit bias, such as the work conducted by Project Implicit, self-assessment, taking the implicit association test to identify your own unconscious biases, reflective practice, reflecting on past patient interactions, seeking feedback, encouraging colleagues and peers to provide constructive feedback on your interactions, and lifelong learning in anti-racism involving an ongoing commitment to understanding, challenging, and dismantling racism in all its forms. Cultivating a culture of awareness, accountability, and continuous improvement is essential for delivering equitable and compassionate care to all patients. To address the system-level recommendations effectively, healthcare institutions can undertake actions aimed at reducing racial disparities and promoting equity in healthcare. Recommendations that can be implemented include implementation of protocol-driven processes that are evidence-based and sensitive to the needs of diverse patient populations, implementation of surveillance programs tied to quality improvement initiatives, and using that data to address identified disparities and promote equitable healthcare delivery. Diversification of the healthcare workforce by developing strategies to attract and retain healthcare professionals from underrepresented groups, implementing programs to create a supportive and welcoming environment, and providing mentorship, career development opportunities, and leadership training for underrepresented in medicine healthcare professionals, and implementation of curricular interventions on structural racism and implicit bias to foster a learning environment that encourages critical reflection and self-awareness among future healthcare professionals. Addressing these disparities requires a multifaceted approach that involves acknowledging and dismantling structural barriers, investing in healthcare infrastructure in underserved communities, expanding access to affordable healthcare services, and implementing policies aimed at reducing racial and socioeconomic disparities in healthcare. By addressing the root causes of these disparities, we can work towards creating a more equitable healthcare system where everyone has access to high-quality care and the opportunity to achieve optimal health. One example of a system-level recommendation is exhibited by Hardiman and his team from the University of Minnesota Medical School, in which they employed a public health critical race praxis methodology to interracial discussions about racism, which yielded new insights and strategies to advance the conversation about racism in healthcare. To effectively address racial disparities in healthcare outcomes at the societal level, we should create and implement interdisciplinary care models that prioritize holistic and culturally responsive approaches to healthcare delivery, including integrating community health workers, peer support specialists, and other healthcare providers into care teams to enhance outreach and engagement with underserved populations. Facilitate partnerships and collaborations among governmental agencies, community-based organizations, private sector entities, and healthcare institutions to combat racism and racial disparities. Encourage dialogue and knowledge sharing among stakeholders to identify systemic barriers and co-design strategies for equitable healthcare access and outcomes. Advocate for policy reforms at local, state, and national levels to address institutional racism within healthcare systems. Use data-driven insights to inform policy and practice interventions aimed at addressing root causes of disparities and promoting health equity. Promote interdisciplinary learning experiences that emphasize the importance of collaboration and collective action in achieving health equity goals. By embracing these recommendations and fostering interdisciplinary collaborations, society can make significant strides toward reducing racial disparities in healthcare outcomes and promoting health equity for all populations. It requires a collective effort that prioritizes community engagement, policy advocacy, data-driven decision-making, and continuous learning to create a more just and inclusive healthcare system. In this article, Dr. Franks and her Emory colleagues challenge us as emergency medicine physicians to utilize the socio-ecological model for the prevention of violence to consider the intersection of causes of trauma of racism and implement anti-racist actions for emergency medicine. Now we have a few questions for discussion. Question 1, name 3 individual level recommendations to combat racism. Question 2, describe how diversification of the healthcare workforce can address racism at the healthcare system level. Question 3, name groups that can collaborate to combat racism. Now we will discuss the answers to the previous questions. 3 individual level recommendations to combat racism include implicit bias and structural competency training, the implicit association test, and lifelong learning in anti-racism. How can we describe how diversification of the healthcare workforce can address racism at the healthcare system level? It improves the delivery of quality care provided by BIPOC patients by practicing medical adherence, shared decision-making, wait times for treatment, and patient perceptions of treatment decisions. The groups that can collaborate to combat racism include governmental, community, private, and healthcare organizations. These are our references. The contributors to this topic are listed on the slide. And thank you for your attention.